Femoral triangle. Femoral triangle is a triangular depression on the front of the upper one third of the thigh, and it is immediately below the inguinal ligament. The boundaries of the femoral triangle are as follows. Laterally, it is bound by the medial border of the sartorius muscle, and medially, it is bound by the medial border of the adductor longus. Base of the femoral triangle is formed by the inguinal ligament, whereas the apex is formed by the intersection of the two muscles from the lateral and the medial boundaries, which is continuous, which is the adductor longus and the sartorius. Here, the apex is continuous below as adductor canal, and roof of the triangle is formed by the skin, superficial fascia, and the deep fascia. Superficial fascia consists of superficial lymph nodes, femoral branch of the genitofemoral nerve, and the branch of ilioinguinal nerve. There is also femoral artery, femoral vein, and the great saphenous vein. There is deep fascia, which is consisting of the sebriform fascia, and the sebriform fascia is the covering of covering the saphenous opening. Second is the floor. The floor of the triangle is formed medially by two muscles, that is adductor longus and the pectineus, whereas laterally it is formed by psoas major and iliacus. Let's see the diagrammatic representation of the femoral triangle. Now here, this is the base which is formed by the inguinal ligament, and the apex is formed by the intersection of the two muscles. Medially there is adductor longus and laterally there is sartorius. Here, the base of the femoral triangle is made by four muscles. Medially there is adductor longus and pectineus, and laterally there is iliacus and psoas major. There is tendon of psoas major. The roof is formed by skin, superficial fascia, and the deep fascia. Let's see the content of the femoral triangle. Femoral triangle consists of femoral artery, femoral vein, femoral sheaths, various nerves, and deep lymph nodes. Firstly, there is femoral artery. Femoral artery is starting or originates from the base to the apex and continues after it in the adductor canal, and it gives 6 branches in femoral triangle, that is 3 superficial and 3 deep. There is femoral vein, which accompanies the femoral artery in the femoral triangle. Firstly, at the origin or at the base, it is medial to the femoral artery, whereas while moving down to the apex, the femoral vein goes posteromedial to the artery. There is femoral sheath, which is an important part of the femoral triangle. Femoral sheath is a 4 centimeter long sleeve which is covering the upper part of the femoral vessels. There is femoral nerve. There are nerves which consist of femoral nerve, nerve to pectineus, femoral branch of genitofemoral nerve, lateral cutaneous nerve of the thigh. Firstly, there is femoral nerve, which originates, that is lateral to the artery, and it lies outside the femoral sheath. Originates in between the grooves of the iliacus and the psoas major. Then there is nerve to pectineus that arises from the femoral nerve just above the inguinal ligament and passes in between behind the sheath and reaches the anterior surface of the pectineus. Then there is femoral branch of the genitofemoral nerve, which lies in the lateral compartment of the femoral sheath along with the femoral artery, and it supplies to the lateral part of the skin of the femoral triangle and all over the femoral triangle. There is lateral cutaneous nerve of the thigh, which is been separated into two parts, that is anterior and posterior parts or branches, and it supplies to the anterolateral aspect of the thigh in the front of the thigh, and it also supplies the lateral aspect of the gluteal region. Then there are lymph nodes. Lymph nodes, that is deep inguinal lymph nodes are present, which drains from the superficial lymph nodes and also drains from the glans penis in males and clitoris in females. Also, it drains from the deep lymphatics of the lower limb. Let's see the diagrammatic representation of the femoral triangle. Above, it is covered by or bound by the inguinal ligament, and at the base there is the apex is made by the adductor longus and the sartorius. Now its content is femoral artery, femoral vein in the blue, femoral nerve which is lying lateral to the femoral artery. Here the femoral artery is giving multiple branches which consist of 3 superficial and 3 deep branches in the femoral triangle. Then there is femoral vein which is medial to femoral artery, and that also gives many branches and collects the blood, venous blood from the great saphenous vein. There are also lymph nodes, that is deep lymph nodes and the superficial lymph nodes, which are present over here near to the femoral vein. Here there is another nerve that originates and comes into the into the femoral triangle, that is lateral cutaneous nerve of the thigh. Then there is nerve to pectineus. This is the pectineus muscle which is supplied by the nerve to pectineus. And there are multiple branches of the femoral nerve that we will discuss later. Content of femoral sheath also Content of femoral triangle also contains femoral sheath, which is a funnel-shaped sleeve which covers upper 3 to 4 cm of the femoral vessels, and this sheath is formed by the downward extension of the abdominal fascia, which includes anteriorly transverse abdominis and the fascia transversalis. Posteriorly, it is made up of posteriorly by this fascia iliaca, which is covering of the iliacus muscle. Inferiorly, the sheath emerges with the connective tissue of the femoral vessels. Femoral sheath is asymmetrical, where its lateral wall is vertical and its medial wall is oblique downwards and directed downwards and laterally. It has 3 compartments formed by the septa, that is lateral or atrial compartment, which consists of femoral artery and genital femoral branch of the genitofemoral nerve. Then there is intermediate and the venous compartment, that is also known as, that consists of femoral vein. Then the third compartment is medial or the lymphatic compartment, that consists of lymphatic nodes in the femoral canal, which is the smallest among all of this. Then there is a graphical representation of femoral sheath. This is particularly the femoral sheath, which consists of 3 compartments. Firstly, there is the medial compartment, intermediate compartment and the lateral compartment. Medial compartment consists of the lymph nodes and the femoral canal. Intermediate compartment consists of the femoral vein, and the lateral compartment consists of femoral artery with the femoral branch of genitofemoral nerve. Another content of femoral triangle is femoral canal. It is the medial compartment of lies in the medial compartment of the femoral sheath, which is conical in shape, and it is 1.5 centimeter long and 1.5 centimeter broad at the base. Its base lies at above and it is narrow below. The base or the upper end of the femoral canal is also called as femoral ring. And the boundaries of the femoral canal are as follows. Anteriorly, it is bound by the inguinal ligament. Posteriorly, it is bound by the pectineus muscle. Medially, the femoral canal is bound by the concave margin of the lacunar ligament, whereas laterally it is bound by the septum separating it from the femoral vein. Then comes the femoral ring, which is formed by the closing which is closed by the condensation of the extraperitoneal connective tissue called the femoral septum. Then there is inferior epigastric vessels, which are closely related to the junction of the anterior and the lateral walls of the ring. Here comes the femoral fascia, which is a depression in the femoral ring due to the covering of the parietal peritoneum from above. Here next is femoral canal, which consists of the lymph nodes of Quoquet, that is Quoquelet or Rosenmuller, and this drains from the glans penis in male and clitoris in female. This is a diagrammatic representation of the femoral sheath. It is 3 to 4 centimeter long and it covers the femoral vessels in the upper part of the thigh. Here it consists of femoral vein and the femoral artery. Also there is a femoral branch of the genitofemoral nerve. Anteriorly it is formed by the fascia transversalis trans and transverse abdominis. Posteriorly it is formed by the fascia iliaca. Over the inferior side, it merges and continues with the connective tissue of the femoral vessels. Above there are three compartments. One is for lymph nodes, that is in the medial side. Intermediate is for the vessels, that is femoral vein, and the lateral one is for the femoral artery, which also has the femoral branch of the genitofemoral nerve. The medial compartment of the sheath, that is also known as the that consists of femoral canal, and it has lymph nodes, and this lymph nodes is covered by a ring that is called the femoral ring, and it is broad at above and it is narrow at below. Let's study the clinical anatomy of femoral triangle. Firstly, there is femoral hernia, which is hernia means simply due to hernia occurs due to the weakness of the muscles and the walls of the muscles. It is the bulging out portion of the muscles and the abdominal wall. Here, if the femoral wall is weakened, then it bulges out, and that is known as the femoral hernia. Femoral hernia is common in females, whereas inguinal hernia is common in males. Femoral hernia occurs because of the wider pelvis and the smaller size of the femoral vessels, whereas it is not congenital. Then the second clinical anatomy is injury to the femoral nerve. This leads to loss of sensation in the anterior aspect of the thigh, in front of the leg, and also in the medial border of the foot till the big toe. Then there is lateral cutaneous nerve of the thigh, which may get tangled in the inguinal ligament and leads to the pain in the lateral side of the thigh, that is also known as meraglia parastatica. And here the fourth and the last is femoral artery, whose blockage is done during the heart surgeries, and also the formalin is injected through this femoral artery to avoid the degradation of the body. Due to the injury to the femoral nerve, there is loss of sensation in the anterior or in the front of the thigh, and from the medial side to the big toe of the foot. Whereas if there is injury or entanglement of the lateral cutaneous nerve of the thigh, which lies lateral in the thigh, so it causes pain in the lateral side of the thigh, and that is also known as meraglia parastatica. That's all for femoral triangle.